Hey y'all, I'm Savannah Goodlett and I'm a family nurse practitioner student at Auburn University, here to talk to you about some nitrofuran antibacterials. So nitrofurans, those are your nitrofurantoin, your macrobid, your macrodentin, and your furadentin. We use those for lower UTIs. They're great against gram-negative and gram-positive bacterias. Not so great against Pseudomonas, doesn't typically work against any of that species. The therapeutic effects. So, because it is absorbed and excreted so fast through the kidneys, the therapeutic serum and tissue concentration levels are just right there in the lower UTI where we want them. One of the great things about this drug class is that it is rare that any bacteria become resistant to any of the nitrofurans. Pharmacodynamics, it releases or it activates some reduced reactive intermediates, breaks through that cell wall, breaks up the DNA, the RNA, the proteins, inhibits the bacterial growth, and kills the cells. So it is absorbed in the GI tract, so we encourage them to take that with food, especially it's absorbed especially through the small bowel. It is distributed only in the urinary tract, and it is metabolized by the kidneys, and then again excreted through your urine. So just to take away, like, it can turn your urine like a dark yellow to a light brown color. So we use this drug for those with acute UTIs, those patients who get chronic UTIs, so 3 or more a year, and those ladies who get coitus infections, like so a UTI before or after, or cystitis before or after. So we can give that to them to take as needed. Rational drug selection, it's cheap. It's pregnancy category B, so you can give it up until right before they're about to have that baby. It is great for acute treatment or for long-term prophylaxis. Few side effects. Adverse drug reactions are rare. Dosing, so you're going to give your adults 50 to 100 mg QID with meals. You're going to give your kids 5 to 7 mg per kg, divided up in those QID doses to take with meals also. For prophylactic use, you're going to give your adults 50 to 100 mg a day, and for the kids, you're going to give them 1 mg per kg a day. Some common side effects are headache, nausea, and like I mentioned, that urine change from, a dark yellow to a little bit of a light brown. So we need to be cautious in giving it to anyone with asthma, COPD, any type of pulmonary impairment, any type of renal impairment, or any type of hepatic impairment. Because, and we also, it is completely contraindicated in those who have G6PD, folic acid deficiency anemia, or infants less than 1 month old, or if you have a creatinine clearance of less than 60 mils a minute. Don't want to give it to those patients, because the most common adverse drug reactions are the hemolytic anemia, pulmonary fibrosis, and peripheral neuropathy. The neuropathy we typically see with those that have been on it long term, chronically, so that you'll tell them to watch for some tingling in their hands and feet and some unusual muscle weakness. You want to tell them to be on the lookout for that difficulty breathing, chest tightness, chest pain, a cough they just can't get rid of, because then we're looking for some pulmonary fibrosis. If they've got some persistent headaches, some nausea with some dark urine discoloration, like we're looking at maybe some bleeding, or easy bruising, easy bleeding, then we're looking and we're concerned for hemolytic anemia. Drug interactions, they do not need to take it with magnesium because it'll delay or decrease the absorption, and they don't need to take it with anticholinergics because it can cause drug toxicity and those adverse drug reactions. Monitoring and patient education, we want to monitor their renal function, their hepatic function, and their pulmonary function. Want to tell them to watch out for those side effects, because while those side effects are typically light, they tend to also kind of coincide with those adverse drug reactions, have about the same type of side effects, just more extreme with the adverse. Don't take it with magnesium, take it with food, and it may discolor your urine, and that's a pretty common side effect. Just a fun fact about UTIs. So E. coli is the most common cause of UTIs, causing like 85% of community-acquired UTIs and 50% of hospital-acquired UTIs. It also, so UTIs in general are responsible for over 8 million office visits a year. So one of my main takeaways is how I remember nitrofurans. Have y'all ever seen E. coli? It's furry. So nitrofuran, it's gross, but it works. And then there's another mnemonic that's the nitroneuropathy, fur fibrosis, and anemia. So you're looking at your peripheral neuropathy, your pulmonary fibrosis, and your hemolytic anemia. It's a first-line treatment of lower UTIs, pregnancy category B, can use chronic or can be used prophylactically for those who have chronic UTIs or acute. So those are your main takeaways. Be careful with people who have kidney issues, liver issues, or pulmonary issues. Thanks, guys.